you've had to stop running. Either you were injured or something changed and now you want to get back into it. It's something that we tackle a lot at Mobility Doc, and we wanted to take a few minutes to discuss with you how you can think about getting back after a pause.
I typically like to think of the post-injury phase of running as three parts. So you have a reintroduction, then you increase volume or weekly mileage. That's another way of thinking of it. And then you increase speed to get yourself back up to about where you were with your total volume and speed.
So let's repeat that part because that's important. Three parts that you think of, whether you're injured or you've just taken a break, right?
Right. Yeah. Kind
So
of three phases.
the three phases of getting back to your running are?
A reintroduction of run walk intervals. This gives your body a chance to kind of get used to doing it, both from like a muscular perspective, but also a neurologic perspective. Then the second phase is increasing your volume. So that's like your weekly mileage. So here is where your body is going to start to accommodate to some like full duration running. So you're not taking any walk intervals. And then finally in that third phase, then that's when you reintroduce some of that speed that you were running pre-injury or pre-break. The reason you're going to do this in this like three-phase process is because you only want to introduce one variable at a time. So that way you can kind of, you can more accurately assess how your body is responding to it.
What is a safe way in phase one to approach the run walk? Like how long should they be out there and what should be the ratio?
So the run walk, what I typically recommend is a 2-to-1 of run to walk. It's a little different for everyone, but I kind of use it as a little bit of a gauge to kind of test how your body is responding. Typically, I don't really exceed about 20 minutes total of running for that first run.
And then how long are you typically in phase one? How do you know when you could progress to phase two?
When it starts to feel like you are doing those intervals and you really don't need that rest in between, so I'll increase the interval time from 2 minutes to 1 minute walk to 5 minutes to 1 minute walk. Eventually you get a pretty good idea that you don't even need that 1 minute. That's when you can progress to phase two, where you focus on building mileage, where you're running the entire time.
Got it. So now we're in phase two and we're running the entire time. What are we doing about speed?
So in phase two, you're not worrying about speed. It's kind of like every day is easy because you're just getting your body used to the volume that you're doing, just spending more time on your feet. So you don't have to worry about the speed.
Let's say I'm an 8-minute miler and I could do an 8-minute mile for like 10 or more miles.
Okay.
Now I'm just running, I'm working just on volume. Like, would you say decrease it by 25% or more? Like, if I just go based on how I feel and I'm feeling pretty good, how do I avoid not just picking up at like an 8.5-minute mile?
Yeah, what I'll say, that's a good question. What I'll say to someone is think of your long run, that speed.
Okay.
And that is now going to be the speed of your short runs.
Okay, so long run speed is now our short run speed. So normally
For phase two.
For phase two. So what we do normally when we're running fast and short, so like our like 10K pace is now our 5K pace, right? In a sense, not in a literal way, but like you're going to run no faster than you would if you had to go out for your longest run that you would do.
Yes.
Not a race. At like a moderate training pace.
Because the whole idea in that phase two is you want to feel good, right? Like you're not actually in your typical training in that moment. You're building that back up. So you want to be feeling pretty good about all of those runs and kind of feeling like, yeah, I could definitely push this pace a little bit. But you're not going to because you're just focusing on increasing the volume that you're doing.
So how do we get out of purgatory in phase two? Like how do we finally get to phase three? What does that look like?
So once you've kind of gotten close to your close to what was your typical training volume, so your weekly mileage, then that's when you can start to reintroduce some speed. So if you previously were running 30 miles in a week, so you've been running now 25-ish miles in a week, maybe even a little bit less, then what you can do is you can kind of move into a little bit of phase three of starting to increase a little bit of that speed.
Got it. So in phase 3, what happens to my mileage? Do I stay at 25 miles and then begin to increase my speed?
Yes. So what I'll say then is like they kind of blend, right? They're not supposed to be these separate and distinct phases. They're supposed to they're a little bit more fluid. So when you're going from phase 2 into phase 3, you're not up at totally your typical mileage, but what you're doing then is you're just a little bit below it. Then you're going to start to increase your speed, but you only change one variable at a time, right? So you're going to stay at that 25 miles and then start to increase your speed. Then once you're comfortable at that increased speed, so now you're running faster than what would be that pace of the long run, then that's when you can start to say, oh, okay, well, now I'm going to stay at this pace and now I'm going to bump up to 28 miles in a week or something like that. So, but then you're going to stay at that same speed. So you only change mileage or pace in a week. You don't change both at the same time. That's where you get re-injured.
So something that I've liked in the past with patients, and I'm wondering your thoughts on, are now that we're in phase 3, things are getting closer towards normal. I normally run 5 days a week. Do you like the idea of starting to build out longer days and shorter days?
Yeah. Yeah. And I actually even start that in phase 2.
Okay.
Yeah. And actually even in the beginning phases of the first phase of reintroducing the running, that's pretty much always what I do. So it's kind of like one day when someone's doing intervals of run walk, one day's a little bit longer, one day's a little bit shorter, that sort of thing. So kind of from the outset, I do that just because it feels a lot more natural to people, that it's like, well, of course, on a Monday or on a work day, I'm going to do a little bit less than on a Saturday or Sunday.
So right from the get-go, you could kind of stick to your longer days, your shorter days,
Yeah.
but just stay within the walk-run ratios.
Yeah, stay within the walk-run ratios in phase 1. Then in phase 2, stay within the weekly mileage. And then in phase 3, stay within the pace.
What's after phase 3?
You're back to your regular training, but with more knowledge. Because in phase 1, 2, and 3, you're doing the recovery work, the rehab work that's been helpful for getting you out of this injury. So you don't just ditch that. Patients will ask you sometimes like, do I have to keep doing this? You do. You really should. I mean, I get that it's hard, right? It's hard for both of us to do that and to want to do that. Harder for some.
Yeah.
I know.
What's a reasonable expectation for how long it should take for phase 1, phase 2, phase 3?
You're not going to like this answer.
Well,
It depends.
of course.
Yeah, well, it does depend
Well,
because think about no, hold on.
Hmm.
Think about how long someone was injured, for example.
Okay, so depending on how long you've been injured, it might change.
Yeah, and then also how the phases are going. Sometimes it's a little more rocky than others.
So things are going swimmingly.
Swimmingly, typically people don't last in that first phase of run walk intervals for more than 2 weeks.
So maybe 2 weeks.
Yeah, that one's rough to do. As someone who just did that this summer.
And then phases 2 and 3, I'm like feeling no pain, it's all going well.
Phase 2 and 3, I would say that together they probably take about 6-ish weeks. I would say. Like
Okay.
if you were being diligent about first beginning to increase mileage, then you stay at, maybe 80% of what your typical mileage is, and then you start to increase speed. Then you stay at that speed, finish out the volume so you get up to your typical training volume, and then you increase speed from there. That takes a while. That really does. So about 6-ish weeks.
Okay. And I think that's fair too, because if you're like a 40 miler person in a week or a 60 miler person in a week versus like a 20 miler person, it's going to take longer to get back. And if you were an Olympic trials qualifier versus just like a weekend warrior, like to get to certain levels will dictate how long it takes to get.
But yeah.
Yeah, not just. If running is part of like more of a lifestyle for you versus your sport.
Yeah, because think about like when you're training for a marathon and say you happen to do marathon training that would take you up to about 50 miles in a week, you're not just always running 50 miles.
It's a good point actually to think of it as like when you're wondering how quickly you should be progressing through this, you think about you're starting your marathon training and how long that would take for you to get back up to a certain mileage when you're starting from week one. It's not that unreasonable
Right.
to spend like like maybe 2 months of getting back
Yeah.
when that's what you would be doing in like a typical like marathon
Yeah.
training.
One of the things that I always say to my patients too is like, this is an opportunity to like have a better routine. So as you do start running again, building that in of like, okay, I'm going to do these three things pre and post run. So like this primer pre-run and then these three stretches post-run is just a really great way. Like starting with a new routine from the outset and doing that can be really helpful for habit forming.
All right, so here we go.
Here we go.
One more time.
One more time.
You were injured or you stopped running, you want to get back. These are the three phases you need to do. Phase 1,
Is reintroduction of running with intervals.
phase 2,
Increasing mileage or weekly volume.
phase 3.
Increasing pace or speed.
Think of it like you're starting a marathon or training for a race. You're starting from the beginning. It takes a little bit of time. The goal is more so how you feel.
Yeah. And it's all about changing one variable at a time, right? So you're increasing just your tolerance to running, then you're increasing your mileage, then you're increasing your speed. They kind of blend together, but remember though, it's very difficult to successfully increase volume and speed at the same time. You really should focus on increasing just volume or just speed.
Here we go. What are you waiting for? Go run, walk.
Let's do it.